So here I have one channel. I really don't care what channel that is. It's not really important to me. But in this case, I'm going to try to bias the vastus medialis muscle a little bit. So that's more the inside muscle. So it's going to be just a little bit to the inside of the thigh. Now I'm going to keep this channel spread apart as much as I can, because that's going to make the electricity dive deeper into the muscle to get to the other electrode. So in this one, we actually want to have the electrodes far, a little bit further apart. And in the case of the quad here, we're going to stagger them. So now I have this one. So this is my second channel that I'm setting up. And I kind of overdid this one. I'll put that one right there. Put that one right there. And we'll put that one right up there. So as what we can see here is that if I trace channel 1 back to the electrodes, you got all your wires here, but this one is channel 1 that I'm going to be referencing. So channel 1 goes to this electrode and this electrode, so I've skipped them. And then channel 2 over here is going to go to this electrode and then that electrode. And again, I've done that to get a deeper penetration of the electrical current. Okay. Now with this one, we're going to have to pre-warn the patient that this is to get a muscle contraction. This will not be comfortable. Okay. To get a muscle contraction, it is slightly uncomfortable, but it's going to feel weird mostly. Now, it might help to explain to them that the machine doesn't do quite as good as the human body does, in that it's recruiting the largest muscle fibers first and the smallest ones last. And that's why it's kind of an uncomfortable contraction. That can be mitigated by having the person contract along with the machine. Then it becomes a little bit more natural. But we'll hold off on having Robert contract just because we want to make sure that we get this right here. So I'm going to turn the machine on. Okay. I don't want the TENS unit, right? I want the electrical stimulation over here. The S stands for synchronous, and so if we're only doing one knee, we're going to do synchronous. Now, if we were going to do both knees, I would put 2 electrodes on one knee, 2 on the other, and then I would go over to alternating, which is going to be right there. Okay, that's only if we're doing both knees. Otherwise, I'm going to press an up button just to get it back to synchronous. It's already on EMS. I'm going to hit set. That's going to go to the time. 15 minutes is good. Okay, so I'm going to set that. It's a wide pulse width, which is good because we need a wide pulse width for muscle stimulation. It's still a high rate, which is good. That's a more comfortable sensation. Okay, and then this is the ramp. This is a 5-second ramp. We don't need quite that much. I want the machine set on like a 3-second ramp. Again, it doesn't matter which down arrow you press. Hopefully the aides will not have to worry about that much, but that is a good setting because it's a 3-second ramp with 10 seconds on and 10 seconds off. So the ramp is at 3, so it's going to be on for 10 seconds, and so I'm going to set that. If I wanted it on for 11, I'd go 11, but I'm sticking with 10. I'm going to hit set again. 10 is what we want, and again, hopefully the aides don't have to worry about that. The therapists, these things should be preset if nobody messes with them. So now I hit set for that. So now we're going to start setting up the intensity, and again, I like to go every other one. If I was doing each knee, I would probably turn one knee all the way up and then go to the other knee. But with this, I'm going to tell Robert to let me know when you start feeling that, and then we're going to try to get your muscle contracting without you making it contract.
Feel it?
Okay, so you're feeling that. And so now we're going to show the muscle, and it's what we should see is that muscle start jumping a little bit here. goes. So we're getting a little muscle movement. And if that gets too uncomfortable, let me know, Robert, but I would like to get a strong muscle contraction if we can. So now that you're feeling that, I'm going to have you straighten your knee a little bit. And now go ahead and tighten that muscle up. There you go. I'm going to continue to turn it up. It will be more comfortable when your muscle is tightened like that. Of course, if this is on their back, they can't do that. And tell me when. That's about as high as you could take it.
Right there's fine.
Right there. Okay, so from there we're going to leave that alone, and we're going to let Robert know that in about a half a minute it's going to start cycling through, and it's going to be on for about 10 seconds, and then it's going to be off for about 10 seconds. And in the case of the quad here, I want you contracting that muscle every time the machine goes on. And we use this protocol a lot when we're icing a knee and or even icing a back. So you can see that it just switched over to the 0 mode, so it's just turned off and now it's ramping up to full intensity. Robert's tightening his muscle, and then he's going to relax when it cycles back down to 0. But we could do quad sets like this while a person is on ice. We could have their knee over a bolster and have an ankle weight on them and be doing short arc quads, exercising with the machine. It's something that we would use to facilitate a muscle contraction. We might use this on the lower trap muscles to facilitate a contraction there. We may also use this on the multifidi muscles of the low back. When we use it on the multifidi muscles of the low back, we want to make sure that we get very close to the spine. We want to make sure that that the person alternates after when they're on the rest period. We'll have them do a glute set, and then when this is on, we'll have them relax. So that's how the protocol would work with the multifidi setup, which we can go into later. But basically, this is how the machine is used. So from here, again, we can't change anything without pressing a down arrow. So if I want to discontinue treatment, I'm going to press the down arrow, hold the off button, and it will shut down. And then when we're taking this off, we're going to peel these things off, stick them back on the sticky parts. If you notice a person's electrodes are getting a little bit unsticky, if that's a word, then you can wash them off and let them air dry, and they'll get sticky again. And then sometimes you just have to throw them away and start over. Please do not put these over skin that has lotion on it, otherwise you'll get about 1 use out of them. So they're made to go over dry skin, not skin that had been lotioned. And of course, you know, we'd label this, put the patient's name on it, and then it would go into the chart. And we do not use these for multiple patients. It's a single patient use. You wouldn't want to put that on another patient. So these are Roberts. Okay? And you guys, again, make sure this with everything we do, not only will you practice this, I want you to practice it on yourself. This is something that you absolutely have to feel to get a sense of how it works. You can put it on your forearm. You can put it where, you know, you can put it on any fleshy part of your body, not across the eyes, of course. But use this on yourself a lot before you ever attempt to put it on a patient. And of course, you need to demonstrate proficiency before we get to applying it to the patient anyway.